Welcome to Good Samaritan Spotlight. My name is Adam Thacker. I'm the President and Chief Administrative Officer here at Good Samaritan. Have a unique guest this session, Betsy Wise, one of our nurse practitioners with Regional Brain Institute and focus on our telestroke program in the hospital, is actually joining us via robot. This is one of the cool technologies that we leverage to be able to bring specialists to Good Samaritan from really across the country that otherwise this care would not be able to be delivered at Good Samaritan. So something that we're really, really proud of. So Betsy, thank you for being here today.
Sure. Thank you so much for having me. I want to start out by saying thanks to Good Samaritan for this opportunity. May is Stroke Awareness Month. So we're really gearing up for the education that's going out to the community, just to make them aware. I think that it's important to know we've done such a great education in the past with heart and heart attack, and we're kind of behind the eight ball, if you will, with stroke awareness. So we've really tried to, over the last decade or so, really try to enhance community awareness with community events and things like this. So Adam, thank you for having me. And why is that important? Stroke is the fifth leading cause of death in our nation, but it's not only it not only can kill you, it's the number one cause of disability. And I think that is very telling for people and people that may know of someone that has gone through a stroke event. It really is a life-altering event, not allowing them to work and get back to independence. And so the more education we get out there, the more that folks are able to recognize symptoms on a timely manner, the more that we can get in and take care of that patient and hopefully turn things around.
Yeah, I think that's such an important piece that you mentioned, that timeliness and stroke. The awareness is certainly growing, and those degrees of separation. I mean, most of us now know somebody that has been affected by stroke, or know somebody that knows somebody that's been affected by stroke. And when that happens in the community, the time to respond, to get to the hospital, to get treatment significantly diminishes that risk of disability or long-term harm. So maybe talk a little bit about that from community standpoint, signs and symptoms. What should somebody look like to have an idea that a stroke may be occurring?
Yeah, and I think it's important to remember this is not just a disease of the elderly. We have young teenagers that have stroke for different reasons. So everyone needs to be able to recognize, whether it's in a young person or a young person recognizing symptoms in an older person that they may be with. So those symptoms, we used to use the acronym FAST, which would get quite a bit of the stroke-like symptoms, but that has really kind of gone by the wayside, if you will. And because we're losing out on some of the other areas of the brain that can have stroke as well. So the new acronym, not new anymore, but new maybe to the community, is BFAST. And I'll go through that with you because I think it's important to, as a catch-all, to get those symptoms. So B is for balance. And we have to remember stroke is a sudden insult to the brain. Whether it's a blockage of blood flow or a ruptured blood vessel, it happens suddenly. You don't get the time that, oh, something might be happening. Or like chest pain and a heart attack, oh, something might be happening. You don't get that a lot of times with stroke. You don't get that sense that something's going to happen. So B is sudden balance problems. Just all of a sudden you feel like you may be walking on a boat, or you just can't steady yourself trying to walk down a hallway. You're having to hold on to things. E is for vision. And we can have either sudden double vision or sudden loss of vision. Blurred vision is in there too, but if you ever have double vision or loss of vision, even if it's painless, please seek medical care. F is for face. So these are going back to some of the traditional symptoms that people recognize, facial drooping. A is for arms. So when we have people that say, oh my gosh, is that person having a stroke? We ask them to lift their arms up and notice one arm may be drifting down. And then S is for speech. This speech can be all kinds of different types of speech. A lot of people recognize it as confused speech. They say things that may mean anything in the context of what they're trying to say. The words may be very garbled, jumbled, may not make sense at all, or it could be slurred, very slurred, like their tongue is super thick. And then, of course, T is for time, and it goes back to time is of the essence. We lose over 1 million neurons per minute when a stroke is happening. And so the faster we get those patients that may be having any of those symptoms into our healthcare system, calling 911, getting them to the ER, we can possibly reverse those symptoms. So we want to, we do put a time limit on some of the acute treatment therapies, because the longer we wait, there's probably already damage and we could actually hurt people if we gave it too late. But if we could get people to remember, it doesn't matter. You don't want to wait an hour just to see if it goes away. Even though we have a 3, sometimes 4.5 hour time window, we don't want people to wait that long to see if it goes away before they come in to get treatment, right? We want them, if they have 10 minutes of symptoms, even if it goes away, and I'll get back to that in a second, but even if it goes away or gets better, please come in, because it may get worse again. And every time you wait, you're creeping outside of that time limit for us to be able to hopefully give you an acute treatment and reverse those symptoms. Now, I mentioned it may go away. A lot of people recognize this as being painless. And so when it doesn't hurt, they don't seek medical attention. They may have numbness on one side of their body, but they don't seek medical attention because it didn't hurt. That could be a warning. And our warnings for a stroke are called TIAs, or transient ischemic attacks. Those are just as important as getting to the bottom of what's going on as a stroke, a true stroke that causes brain damage is. So again, please don't wait. We want you to come in and get treatment as soon as possible.
So be fast, and a couple of things that resonate with me in that discussion is, unlike we think about with heart attack where the patient can feel pain, the patient knows something going on, be fast, a lot of that is for somebody to recognize that somebody else is actually having the stroke, because it may be painless or really unnoticed by the patient themselves that is going on.
That is so right. We have parts of our brain that may not allow us to understand or notice what is happening on one side of our body or the other. So if you notice anyone in front of you that starts having any of those symptoms, that they are hearing somebody saying, oh my gosh, I'm suddenly, dizzy, or suddenly I can't see. Or do you notice a facial droop on someone that's in front of you, or they can't walk right? Just they were walking right and all of a sudden they're just stumbling all over the place. Yeah, you definitely want to get to them and call 911.
Right. And then the second piece that you just kind of touched on, but it's not necessarily you have to check all of the boxes of be fast. If patient is having any of those symptoms that are serious, then the time is so important that the extra caution is get to the healthcare provider, get to the ER, call 911, and get care delivered. I'm sure we could all agree that being overcautious is much better the place to be than waiting too long and being outside of treatment that could be life altering.
That's right. And I think one of the most common things that we see are people that come in with dizziness, sudden dizziness. And that could mean, a whole host of different things. But we elevate that care to rule out the stroke first, because we want to do all the treatments that are possible for stroke, and we have such a limited time that we can offer those treatments that goes back to having telemedicine being able to be provided in your hospital there. We can get called as soon as that patient arrives, and we can help work with the ER staff and making sure, is this patient having a stroke or not having a stroke? We're the experts. We come in and work with those patients and the ER staff there to get the patient what they need.
Well, and that's a great segue. So we're having this conversation, and you're on the robots. So talk a little bit about, for patients that are now in the hospital or in our ER, having a stroke or stroke symptoms. How do you and the Regional Brain Institute team interact through the two robots that we have at Good Samaritan?
So yeah, thanks for that. So we have a whole team of telemedicine providers made up of both neurology and neurology experts, whether they be MDs, doctors, or nurse practitioners, to bring the level of expertise in neurology to the community. It's so important. The community needs to keep their patients. That's where their support systems are, things like that. So it's allowed us to bring our expertise to your hospital. So how does that work? What happens is, if there is an acute stroke patient or a rule out stroke, anybody with stroke-like symptoms that comes through your triage system in the emergency department sets an alert off. And if it's an acute within a small treatment window, that's one way that we get alerted. Regardless of if it's in that acute window or the ER staff calls us as a consultation in, we come in just like you're seeing me now on a robot. It's a, face on a card, if you will, but you're real time talking to me. I'm examining you with the help of an ED staff person, so they can physically lay the hands on you to get me and manipulate the patient how I need to. But it's interesting how long I've done this, and patients forget that you're physically not in the room. You were engaging those patients and bringing them the expertise that they need for that level of care right then, just with the help of a few hands. But all the other care stays the same in the ER. So it's really interactive. The patients talk to me just like you're talking to me now. I go through my exam, some without the nurse, some with the nurse, some with the ED physician, all the imaging, everything else. I'm able to have access to all of that imaging. So we look at all of our own imaging and bring that specialized care as if I'm in there in the hospital with them. Now, if they're admitted to your hospital, they get the same exact level of care. We come in and we see the patient. We work with the hospitalist staff there. We're part of a team approach of care to every single patient that we follow. We also have that capability in the outpatient world too. So we have outpatient stroke clinic, outpatient neurology clinic, using this telehealth system just as interactive as I am with you now.
Yeah, and that's so important, as we know with stroke, and you mentioned it very early on. There's the time is so important up front, but there's a long road to recovery for a patient that has had a stroke, and being able to keep that care close to home, bring neurology specialists such as yourself to not only the inpatient setting, but all the way from the ER to the inpatient to the outpatient setting is something that we're really proud of, and we've had this partnership for a number of years now, and patients are having better outcomes because without this service being delivered, care is over an hour away, and it goes right back to that T piece. Time is of the essence, and so you're able to use the hands, so to speak, of our team to really drive the care that needs to be delivered. So thank you for that.
Yeah. Sure. And really it is bringing awareness of what your risk factors for stroke are. Okay. And sometimes we don't know what those are until they're checked. Ignorance is bliss until it's not. And unfortunately, on my side of the business, we have a lot of people that just don't realize they have high blood pressure because they've never had it checked.
Okay, well, Betsy, thank you. It's been very, very informative, and hopefully had an impact on some in the community about increasing stroke awareness and how to just be aware of your numbers as a patient, and also if somebody else is having a stroke, how to recognize that and potentially have a role in saving someone's life.
Awesome. Thank you so much for having me, guys. Appreciate it.
All right, that concludes this session of Good Samaritan Spotlight. Thank you.